In the last 24 hours, India has reported 3,14,835 new cases of COVID. 2,104 people have lost their lives. It is for the 8th straight day that India is reporting over 2 lakh coronavirus infections. This is the latest number that we are in fact reporting. Let's go right across to my colleague Akshay Dongre tracking the latest. Akshay, India crosses 3 lakh COVID-19 cases, over 2,100 deaths.
Well, yes, in fact, the situation that we are looking at right now, the numbers that we are reading every day, this, in fact, is the worst situation all across the world that we are seeing in India. The number of cases are continuously rising, and there is no sign still that the number of cases will die down anytime soon. In fact, we have seen that the senior doctors, in fact, the government has already said, in a meeting with the Union Territories, Dr. V.K. Paul, who is a member of NITI Aayog, also heading India's fight against COVID-19, has said that the next 3 to 4 weeks are going to be extremely crucial, because not only the number of cases from the indicators seem that they will continue to rise, but also as the number of cases rise, this will further burden the healthcare infrastructure, because as the numbers are continuously rising, same amount of people are not recovering from the hospitals that has increased the workload. When we are talking about the crucial healthcare infrastructure, earlier we used to talk about the beds, we used to talk about healthcare workers, hospitals, but now we are also talking about medicines like remdesivir. We are talking about oxygen supplies to the hospitals. That is in fact extremely crucial to treat the patients that are in the hospital. So extremely stressed the entire healthcare infrastructure, be it testing, be it hospitals, or be it the crucial infra like oxygen. So it remains to be seen that what exactly is going to be rather the plan of action by the government. But this is extremely critical and extremely grim landmark that we have crossed today. And with more than 3,14,000 cases, there is still no respite as far as when we are talking about flattening the curve is concerned, because this, in fact, the healthcare workers have been saying that's not a curve. In fact, it has become a wall. If you look at the graph of the number of cases that have increased in the past 1 month.
Right. Akshay, over 3 lakh cases being reported, over 2,100 deaths. It is, every single day that we report on a new record surge in COVID-19 infections. There is, of course, a double mutation of the coronavirus, which is believed to be more contagious. There are also reports now of a triple mutation that is being found in West Bengal, Maharashtra and even Delhi. These are, remember, states that are also seeing a corresponding spike, daily record surges in COVID-19 infections. It is officially the world's worst outbreak. What we are seeing is, a very grim number there. What are you picking up, Akshay, at the moment from experts, epidemiologists? We know that many have predicted the situation to get worse before it actually gets better.
Well, there is still no telling, Rishika, that when exactly the situation is going to be better. The government has said that the situation will only get worse before it gets better. So that has been a clear, in fact, a hint from the government that the situation will be extremely critical for the upcoming days. But when we are talking about the situation, how did we land here? Where have been the lapses? Was the government caught off guard? Were the authorities caught off guard? When we are talking about the double mutation, triple mutation, and the variants of concern that are there, was there not enough genome sequencing? Were there not enough checks and balances to see that what exactly is going to be the situation if these kind of mutants of virus that are considered immunoescape, that have the immunoescape the ability in them, and other changes that might in fact make them immune to the vaccine as well. So there has been a lot of questions and not enough answers from the government that how exactly we are going to tackle this further outbreak that continues to rise, Rishika.
All right, let's get a reaction from Dr. Yatin Mehta joining us on the phone line. Dr. Mehta, highest ever cases and deaths reported, 3.14 lakh new cases, over 2,100 deaths. How are you looking at these numbers?
Well, first time the wave came, I was not petrified. Now I'm petrified, because every few minutes I'm getting phone calls regarding ICU beds and hospital beds for COVID, and the beds are completely saturated. And on top of that, the pressure of the oxygen supply. So that is also creating panic and worry. So I think it's a major concern everybody should put their heads together, stop blaming each other, and just get their acts together. I think I don't see testing is down, labs are not going home to test, the test report takes 2 days to come. I think all this, and plus there is no, I think home care is completely gone. First time it was much better. There is no quarantine proper, one family member gets it. I must warn everybody, please, one family member gets it, every family member seems to be getting the disease. So isolation has to be strictly practiced. You do not see the face of the patient till he is cleared. I think so. We must realize that we are spreading it. Public must cooperate, and all the government should work together, state and the center, and try to resolve this. Otherwise, we are doomed.
Dr. Mehta, the latest data as far as vaccinations are concerned, adverse effects after vaccination or even protection that vaccines are giving is very encouraging, the latest data that's been released from the government. Many experts, many public health experts, however, say that you can't vaccinate your way out of a surge. The vaccine cannot beat the virus at this point. Public health emergency measures need to kick in. Which way do you weigh in?
Absolutely rightly put, Rishika. I think public health measures is what is going to, and healthcare in the secondary and tertiary care hospitals is going to take care of the surge. The vaccine is not the solution just now. Vaccine may be the solution a few months down the line. So please, for everybody who has taken a vaccine, I must convey to them that vaccine is not a foolproof protection. You must continue with COVID-appropriate behavior and forever till the government tells you that it is okay to take off your mask. I think at the moment, this is your only protection. So vaccination is protection later on.